Hello, my name is Dr. Piyanat Priyanon, an interventional cardiologist from Perfect Heart Institute here in Bangkok. I have Dr. Roopa Salwan with me today. Welcome to Bangkok, Dr. Salwan.
Thank you. Thank you so much.
So, do you think the Lumen Global meeting making any difference in acute MI care, and what are its contributions?
I think Lumen Global is an amazing meeting that gets together people from all parts of the world. And I think without meeting and sharing and learning from each other, none of us knows it all or has done it all. And there's so much to learn from each other. And I think when we sit together and talk, we realize that so many things are similar. And there are people who have done it before us. They have systems that have grown before us. And I think in this more important is while the West is been ahead of us, as we Asian countries sit together and deal with our challenges, it is very real and very one-to-one. And there's so much to learn from each other in how the problems are tackled and how we are getting better. And as was pointed out in the meeting, cardiologists are a very competitive lot. And it does bother us if others are doing better than us, and we become drivers of a system that finally is a win-win for the patient. At the end of it, all of us want our patients to do better. And I think sharing ideas is the only way any civilization grows, and as interventional cardiologists, to have an open mind, to integrate teams, to go out to the periphery, to engage with our referring physicians, to engage with the emergency services. I think it's Lumen is leading the way, and it's a very important forum that encourages cardiologists to come out of their shell and merge with the entire healthcare community that's serving the patients. So the contributions of Lumen are immense, and meeting by meeting I feel it's growing in strength and it's becoming a bigger movement. And I sincerely hope this becomes a path. I mean, it's beyond governments, it's beyond territories, it's beyond just cardiologists, and it is a very integrative movement which I feel should make a bigger impact in saving lives of patients who have acute heart attacks.
And what are the biggest challenges in doing primary PCI in India?
Primary PCI is growing rapidly in our country. Currently about almost 12% of interventions done in our country are primary interventions. All cath labs, while there are almost more than 800 cath labs in the country, all cath labs do not have the ability to provide a 24/7 cover. And as we have learned from others' experience, centers with high volume, with well integrated teams, in them we are able to see the benefits of primary. Just putting up a cath lab or having a cardiologist come and do the intervention and leave will never give the results a primary intervention is meant to. And I think the biggest challenge for Indians cardiology community is to start documenting what they are doing, start documenting their outcomes, and be honest about it. You know, in our hearts we all may know the ideal circumstances, but it takes a lot to say that yes, I knew that was the best, but it didn't happen for this patient, and I want to improve my system to make it better. So the more honest we are with our data, and even centers which have cath labs but don't have 24/7 facilities should be upright in making the network, in linking with centers that can give that care, lysing a patient, triaging a patient appropriately, knowing whom to transfer and what to deal with. End of the day, it's about saving lives, and I think and being accountable in what you are doing. And I think that's the biggest challenge for intervention in India, is to give fibrinolysis its due respect, to not look at it as an inferior therapy, but it is as good if it is given at the right time, and all of us know from data within the first 2 hours it is as good as doing an intervention. So, partner with centers who are doing fibrinolysis, stabilize patients, be there on a telelink, be there for your patient, and finally document your outcomes. That's the biggest honesty we need our cardiologists to have, to document their outcomes.
And tell us about your radial approach experience and your view of doing radial STEMI intervention.
Radial interventions are growing world over, And I think centers which, STEMI should not be your first radial intervention. Centers which are routinely doing a lot of transradial work could do STEMI also through a radial, but this is the least of what worries you. You have to get the artery open. Whatever you're comfortable, whatever your normal cath lab setup is, you should do what is standard, because the route doesn't affect. You have to open that vessel up. And definitely cath labs, high volume cath labs doing a high level of radial work routinely are the ones who would be able to take the STEMI challenge, and not labs who are not doing radial interventions for more than 5 or 10% of their work. Many times also you have to know your backup. I mean, how many people you have for an interventionist who's alone in a hospital without much backup. Having the femoral vein and artery secure in your hand is so much peace of mind, rather than worrying about taking an access in a patient who destabilizes. So I don't think access really makes a difference. It's the flowing vessel, and you should do what you are good at, what you are comfortable, and what your patient needs.
Well, thank you so much for joining us today, Dr. Salwan.
Thank you. It's been my pleasure.